Hi everyone and welcome to our health lesson this third quarter period. This lesson will cover Module 1 and Module 2 in health this third quarter. The main focus of this lesson is all about the first aid and prevention for different unintentional injuries. At the end of this discussion, I will be showing the activities you need to answer. So listen carefully in the discussion and take down notes of the important details that may help you in answering the modules. Let's now begin with the lesson. You might be familiar with the saying, prevention is better than cure. Practicing this principle advocates safety awareness, which is essential in achieving quality of life. But our immediate environment poses danger to everyone. No place is considered safe, not even in the comfort of our homes. Accidents may happen to anybody at any place at any time. Thus, taking the right safety measures greatly helps prevent accidents and injuries. Nevertheless, when accidents happen, it is important to have the knowledge and skills to deal with them. Having knowledge and skills on safety education and injury prevention could help you, your loved ones, and other people in your community during emergency situations. Let's start with defining what first aid is. First aid is an immediate and temporary care given to a person who suddenly gets ill or injured. It includes self-help and home care if medical assistance is not available or delayed. It can mean the difference between life and death in extreme cases. However, we must know the limits of the first aid we can give because improper first aid can actually do more harm than good in some instances. Anyone who gives first aid is a first aider. Here are the different roles of a first aider. First, it is a bridge that fills the gap between the victim and the physician. It is not intended to compete with or to take the place of the services of the physician, and it ends when the services of the physicians begin. Here are the main objectives of giving first aid. It aims to save lives, to prolong lives, to alleviate suffering, and to prevent further injury. If you will be a first aider, here are the characteristics that a good first aider should have. You should be gentle, observant, resourceful, tactful, and sympathetic. Being gentle means you don't cause pain and panic. Observant, you notice all the signs. Resourceful means you make the best use of things at hand. Tactful, you don't frighten the victim. And sympathetic, it means you comfort and reassure the victim. In giving first aid, we have different principles to remember or the do's and don'ts in giving first aid. Let's start with the do's. Do stay calm. Do reassure and comfort the victim. Do check for a medical bracelet indicating a condition such as epilepsy or diabetes. Do loosen any tight clothing. And do keep the victim covered to reduce shock. And for the things to avoid, first, don't give food and drink to an unconscious person. And don't move an injured person unless you need to place him or her in the recovery position. Now let's go to the different steps to follow when you encounter an emergency situation. Here are the emergency action principles. Step 1. Make sure the scene is safe. If yes, proceed to the next steps. But if not, do not attempt to go to the accident. Call emergency medical services instead. Step 2. Make sure the victim is lying on his back, and if not, roll the victim. Step 3. Check for responsiveness by gently tapping the shoulder of the victim by saying, "Hey, hey, hey, are you okay?" Step 4. If there is no response, call for help immediately. Step 5. Do the primary survey of the victim. In doing this, Remember the acronym ABC. A for airway. Check if there is a blockage in the airway. If yes, take it out by using your pinky finger in a scooping motion. B for breathing. Use the maximum head tilt, chin lift method and look, listen, feel. If negative, perform rescue breathing. C for circulation. Use carotid pulse. If negative, proceed to step 6. Step 6. While applying maximum head tilt chin lift method, pinch the nose and give 2 initial full breaths to the victims. Step 7. Take off the clothes of the victim that can block the compression area. Step 8. Perform CPR on the victim. CPR means cardiopulmonary resuscitation. Do 5 cycles of 30 compressions and 2 breaths. Step 9. If the victim is revived, do the secondary survey of the victim. If not, continue performing CPR while waiting for the rescue team. Lastly, when the victim is conscious, we proceed to step 10. Do the secondary survey. Record all the data and surrender to the rescue team. Interview the victim of the following: symptoms, allergy, medication, past medical history, last oral intake, events prior to the accident, and in doing this, remember the acronym SAMPLE. Next is checking for the vital signs. Carefully check for the following vital signs. For eyes, if it is dilated, it means the victim might be shocked. If it is constricted, it might mean stroke or drug abuse. If the pupils are unequal, it might be stroke or head injuries. For nose, if it is watery, it may mean fracture or skull injury. For skin color, if it is bluish, it may mean lack of oxygen or cyanosis. And check also for the body temperature and blood pressure. Last is doing a head-to-toe examination. In doing this, check for the following: deformity, contusions, abrasions, punctures, burns, tenderness, lacerations, and swelling. Now let's proceed on the steps on how you can check the vital signs of a person so you can better assess the victim's condition. Vital signs are measures of various physiological statistics taken in order to assess the most basic body functions. The act of taking vital signs normally entails recording body temperature, pulse rate or heart rate, blood pressure, and respiratory rate. Let's first start with the steps in checking the pulse. Use your fingertips in getting the pulse. Follow the following procedure. Place the fingertip over an artery where it either crosses a bone or lies close to the skin. Feel the pulsations as the pressure wave of blood causes the vessel wall to expand. That is the pulse. The pulse rate may be taken in different points in the body like brachial, subclavian, carotid, axillary, wrist, femoral, and temporal. Here are the things to avoid in getting the pulse rate. Never use your thumb. It has its own pulse. Do not palpate both the carotid arteries at the same time. Do not take the pulse when the victim is in sitting position. Pulsations disappear as the victim is elevated to a sitting position. Never put too much pressure or massage the carotid. You may disturb the heart's electrical conduction system. Here is a reference for you to know if the pulse rate of the person is normal. 60 to 70 for men, 70 to 80 for women, 80 to 90 for children over 7 years old, 80 to 120 for children over 1 to 7 years old, and 110 to 130 for infants. Next, here are the guidelines in checking for the temperature. It is being important to monitor temperature in the case of stroke and high fever. Body temperature is measured by using a thermometer within the rectum or rectal, oral or through the mouth, and axillary or through the armpits. Next are the guidelines in checking for respiration. Count the number of breaths per minute. A whistle sound or wheeze and difficulty in breathing may mean an asthma attack. A gurgling or snoring noise and difficulty in breathing may mean that the tongue, mucus, or something else is stuck in the throat and does not let enough air to get through. Between 12 to 20 breaths per minute are normal for adults and older children. 40 breaths per minute are normal for babies. In checking the skin color, here are the guidelines to follow. Skin color reflects the circulation of blood and the saturation of oxygen in the blood. The presence of mucus around the mouth, inner eyelids, and nail beds is a sign of poor blood circulation. A healthy skin that's warm and pink because of blood flows normally in the blood vessels. Here are the things to consider in doing a head-to-toe examination. Let's first start with the head and neck. Are there any lacerations or contusions in the area? Is there a presence of blood in the victim's hair? If yes, immediately find out where it is coming from. Is there any fluid in the victim's nose and ears? If so, the victim has a skull fracture. For the eyes, pay close attention to the pupils. If the pupil's appearance is dilated, it is under state of shock. If the pupil is very small, it means poison or use of prohibited drugs. If it has different size, it might be head injury that requires immediate attention. If it is small and bright, then the pupils are reactive. If the pupil has no reaction, then it means death. In checking the chest area, check for cuts, bruises, penetrations, and other impairments. If the victim feels pain while you apply pressure onto his or her chest, there could be a rib fracture. For the abdomen area, does the victim's abdomen hurt? Where is the pain coming from? Is his or her abdomen tender? Did you feel any lumps? If yes, get immediate medical assistance. For the back area, is there movement in the victim's lower extremities? Is there sensation in these parts? If the answer is yes, do not move the victim. Immobilize him or her. Let's now differentiate signs versus symptoms. Signs are details discovered by applying our senses, like sense of sight, touch, hearing, and smell during the course of the examination. Example, bleeding, swelling, deformities. And if it is symptoms, these are sensations that the victim feels or experiences and may be able to describe. For example, nausea, vomiting, heat, impaired sensations. There are two ways to conduct physical examination when giving first aid. We have primary and secondary survey. What is the difference between these two? Primary survey of the victim is used when the victim is unconscious and to find out and immediately treat life-threatening conditions, while secondary survey is used when the victim is conscious or has revived. It aims to detect everything about the patient's condition. Let's now proceed to the next part of this lesson, which is all about dressings and bandages. Let's start with dressing. A dressing is a piece of sterile cloth that covers a wound to prevent infection and/or to stop the bleeding. Here are the different techniques in applying a dressing. Wash hands and wear gloves if possible. Unwrap the dressing as close to the wound as possible. Be sure not to touch the wound. Skin is not sterile. If the dressing slips over the victim's skin while you are trying to position it, discard and use a fresh one. Place the dressing over the wound. Use a dressing that is large enough to extend at least 1 inch beyond the edges of the wound. If body tissue or organs are exposed, cover the wound with a dressing that will stick. Then, secure the dressing with a bandage or adhesive tape. Another way to treat injuries is cold compress. It is used to reduce swelling and relieve pain, especially used for sprains and strains. Cold packs can be used as cold compress. Hot compress is also used to allow normal blood circulation. Cold and hot compress are applied alternately for closed wounds or contusions. Next one is bandages. These are used to apply pressure to bleeding, for covering wounds and burns, and providing support for immobilization for broken bones, sprains, and strains. There are 3 main types of bandages, namely triangular, ACE, and tubular. Triangular bandage is made from cloth and can be used as cold compress, padding, support for pressure, or support sling. ACE bandage secures dressing in place. And tubular bandage is used to support joints or hold dressings in place. Smaller tubular bandage is used for finger injuries. Here are the different parts of a triangular bandage. We have 2 phases in bandaging. The first one is an open phase. This is used for wounds on top and back of the head, chest, back, hand, and foot, and as arm sling. The second phase is called the cravat phase. This is used for wounds that need extra support like wound on the eye, forehead, ear, cheek, jaw, shoulder, hip, arm, leg, elbow, knee, and palm, and for a sprained ankle. The narrower the cravat is, the greater pressure it will give. Here are the different techniques in bandaging. Keep in mind the following. A. Always use a square knot. B. Keep the cloth sterile to avoid infection. C. Always keep the ends. Bandaging technique depends upon the size and location of the wound, your first aid skills, and materials at hand. Bandage firmly over bleeding and securely over the broken bone, not so tight so as not to cut off blood circulation. When wrapping bandages around the body such as knees, ankles, neck, and small back, use its natural hollows to slide the bandage gently into place. Since most injuries swell, check regularly to ensure that the bandage is still comfortable and that it remains firmly secured. Secure the bandage with a tape, clips, or a bow or square knot. Ensure that the bandages, especially the knots, do not touch the skin. Now let's go to the topic about wounds, its different kinds, and how to treat them. A wound is a break in the continuity of a tissue in the body. It may be closed, in which there is no break or damage in the skin. It is also called hematoma or contusions. A wound may also be open wound in which there is a break in the skin. The first kind of wound is puncture. Puncture is a piercing wound caused by nails, needles, and other pointed objects. Next is abrasion. Abrasion is caused by rubbing or scraping the skin against a rough surface. Third is incision. Incision is a cut caused by knife, broken glass, or any sharp object. Fourth is laceration. Laceration is a blunt breaking or tearing of soft tissues, usually resulting from mishandling tools and other accidents. And the last one is avulsion. Avulsion is a forcible tearing or partial tearing away of tissues. This is how we can treat these wounds. A. For management of hematoma, we use the mnemonic RICE. RICE is an acronym which means resting the injured part, ice application, compression, and elevation. Letter B, first aid for open wounds with severe bleeding, we have wear gloves and remove or cut clothing as necessary to expose wound. Control bleeding by applying direct pressure. Elevate the injured part above the heart except for eye injury and wounds with embedded object. Cover wound with sterile dressing and bandage. Care for shock. Lastly, consult a physician immediately. This time, I will show you the different kinds of unintentional injuries. When we say unintentional, these are injuries that are caused by accidents or mga injury na hindi sinasadyang mangyari. We will also learn here how to give first aid on these different injuries. First, we have fracture. Fracture is a break or crack in a bone. An open fracture pierces the skin surface, while in a closed fracture, the skin above is intact. The first aid for this is, first, check for vital signs. Do not move the injured part. Stop bleeding if there is any. If you have to move the person, immobilize the broken part by splinting. Lastly, seek medical help immediately. Next is dislocation. It is a partial or complete displacement of bones. The first aid for this, first, call for help immediately. Splint the affected part. Do not try to move a dislocated part or force it back into place. And lastly, apply ice on the injured part to reduce swelling. Next is sprain and strain. Sprain is an injury to the ligaments of a bone due to accidental tearing or overstretching, while strain is an injury to the muscles which is a result of improper use of the muscle. The first aid for sprain and strain, first, rest the injured part, apply ice, compress the injured part, and elevate the injured part. Another one is heat exhaustion. This is caused by loss of salt and water due to excessively high temperature. This may lead to heat stroke and even death. First aid is transport a victim to a cooler place, give him or her plenty of water, check for the vital signs, seek medical help. Food poisoning is caused by consuming food or drink that is contaminated with bacteria or viruses. The first aid for this is first, help the person to lie down and rest. Give him plenty of flavorless fluids to drink and a bowl to use if he vomits. Call for medical help if the condition worsens. Next is choking. Choking results when a foreign object blocks the throat. The first aid for this is, first, ask the person if he is choking. Encourage him or her to cough. When the person cannot speak or stops coughing, give him 5 back blows. Stand behind him and help him lean forward. Support his chest with one hand and give 5 sharp blows between the shoulder blades with the heel of your hand. If back blows fail, try abdominal thrusts. Stand behind the person and put your arms around the upper part of his abdomen. Clench your fist with thumbs inward. Place it between navel and bottom of breastbone. Grasp your fist with your other hand. Pull sharply inwards and upwards up to 5 times. Check his mouth. If obstruction is not cleared, repeat the back blows and abdominal thrust. If obstruction still has not cleared, call for an ambulance. Continue until help arrives. Next one is drowning. This happens when air cannot get into the lungs because of water. It can cause immediate death when taken for granted. First aid for this: lay the person down on his or her back. Check breathing and open the airway. Give rescue breaths and chest compressions if necessary. If the person is breathing, place him or her in the recovery position. Lastly, treat for hypothermia by removing wet clothing and covering him or her with a dry blanket. Another fatal injury is heart attack. This is caused by sudden obstruction of blood supply to the dart of the heart muscles. First aid for this: help the person sit or lie down with head elevated. Call for medical help. If the person is conscious, give him or her a full dose aspirin and advise him or her to chew it slowly. Constantly monitor the vital signs. Be prepared to give rescue breaths and chest compression. Next one is chemical burns. This may occur when electricity passes through the body. First aid: make sure that contact with the electrical source is broken. Flood the sites of injury at the entry and exit points of the current with plenty of cold water. Wear disposable gloves and place a sterile dressing or a bandage over the burn to protect it from airborne infection. Call for medical help. Reassure the victim and treat for shock. Next one is burns. These are often due to domestic incidents such as touching a hot iron, friction like rope burn, or spilling boiling water on the skin. First aid: for minor burns, flood the injured area with cold water for at least how long to stop burning and relieve pain. Put on gloves and cover the area with sterile non-adhesive dressing or bandage. For severe burns, help the person to lie down and prevent the burnt area from coming into contact with the ground. Douse the burn with plenty of cold liquid. Next step: seek for medical assistance. Do not delay medical help. Wear disposable gloves and gently remove any rings, watches, belts, shoes, or smoldering clothing before the tissues begin to swell. Carefully remove any burnt clothing unless it is sticking to the skin. Cover the burnt area with non-adhesive dressing or bandage. Continue to monitor vital signs. Reassure casualty and treat for shock. Next one is heat stroke. This is caused by a failure of the thermostat in the brain to regulate body temperature. When this happens, the body becomes seriously heated. First aid: move the person immediately to a cool place. Remove as much of his outer clothing as possible, and call for medical help. Next step: wrap the person in a cold, wet sheet and keep the sheet wet until his temperature drops to 38 degrees Celsius or 37.5 degrees Celsius under the tongue or armpit respectively. If the person has returned to normal temperature, replace wet sheet with a dry one. Monitor vital signs until help arrives. If temperature rises, repeat the cooling process. Next one is stroke. Stroke is a condition in which the blood supply to a part of the brain is suddenly and seriously impaired by a blood clot or ruptured blood vessel. First aid: If the person is conscious, help him or her to lie down with his head and shoulders slightly raised and supported. Incline his head to the affected side and place a towel on his shoulder to absorb any dribbling. Next, call for help. Loosen any tight clothing. Monitor vital signs and reassure the victim. If the victim is unconscious, give rescue breathing and chest compression. Call for an ambulance or call for help. Now for the last part of this lesson, here are the different ways and proper techniques of transporting a victim. Transporting an injured person to a safer place requires great care. A first aider must undergo proper training. When doing this, a first aider must consider the following factors. First, weight and height of the victim, status of the victim, if he is conscious or unconscious, environment, if it is safe, if the floor is smooth, if it is narrow or wide, and special needs and considerations like injuries of the victims. Under one-man transport category, we have fireman's carry. This is the easiest way to transport a light and smaller victim. Another one is piggyback. This is done when the victim is conscious. Backstrap carry. Do this when the victim is smaller than the first aider. Fireman's drag or tied hands crawl is used when the first aider and victim must crawl underneath a low structure. The last one for one-man transport is the blanket drag. This is used when the victim is seriously injured and should not be lifted. Next category is the two-man carry. This requires two persons. Under this, we have the chair or seat carry, used when there are two first aiders and a chair available. The last category is the three or more man transport. Under this, we have hammock carry, which is done when there are three first aiders. Bearer alongside carry, wherein the carriers will stay on the uninjured side of the victim. And the last one is the six-man lift and carry. This is done when there are six first aiders available in the area. Lastly, for the generalization of our lesson, unintentional injuries cannot be avoided. It happens at any time, at any place, to anybody. Therefore, we must practice safety awareness at all times. But when injuries happen, appropriate knowledge and skills of the proper application on first aid could greatly help in alleviating the pain, preventing further injury, prolonging, and even save lives. And that ends our lessons for the third quarter of Health Today. I hope you learned a lot about the different unintentional injuries and how to give first aid to them. Now, as I said earlier, I will show you the activities that you need to answer in your Health Module 1 and Module 2. We have 4 health modules this quarter. Next week, we will do the Module 3 and Module 4. Please make sure that you finish all your activities. And that ends our lesson for today. If you have any questions, you can reach me through these posted social media platforms. Thank you all for listening and see you in our next lesson.